Hey guys, Jasmine of IPS. Today we're talking about what is the healthcare revenue cycle. We're going to split this video up into a few different parts so that we can take a deep dive into each specific element. So in the revenue cycle begins with the physician ordering or referring a patient to a facility or another physician's office. So it actually initiates with the patient. Usually that referral is either provided to the patient or done electronically, and the patient then is scheduled or receives a call to schedule an appointment with the new facility. So the initial part of the revenue cycle does start with the patient, and it even happens before the patient is seen in the new office. Once that patient has contacted the new facility or the new facility has reached out to them, then the patient will schedule an appointment and the registration process begins. So registration can look very different depending upon the type of practice. We see a lot of practices these days utilizing virtual ways to provide their patients with intake forms. So whether that is sending them a typable PDF or perhaps completing an entirely electronic registration, it's really kind of runs the gamut. I would say that there are still practices doing paper registration and forms. If you are still doing registration on paper and the patients are filling out the forms, you are behind the curve and you should look at doing things more electronically. The reason for that is that when patients are having to handwrite information, it usually in this day and age, it's a pretty frustrating process for a lot of patients, obviously depending upon their age and the speed at which they like to operate. You'll find that some patients would be more frustrated and perhaps make it all the way to your office without that paperwork completed. So then you have to provide that paperwork to them, and then now they're investing time, the hours that perhaps you were going to be spending with that patient. Now they have to spend a portion of that time to complete their paperwork. So there's a lot of reasons why the handwriting of paperwork is not good. Another element of that is another reason why you don't want your patients having to handwrite their information or registration on your forms as often as another reason why you don't want patients to have to complete their paperwork manually and handwrite on their forms is penmanship. Very simply, it's a lot of energy and time for your staff to try to translate or make sure that they can properly read the information that's written on the registration form. So what that means is now they're investing time in trying to figure out what's happening, and perhaps they don't have the opportunity to address this with the patient before they're entering this or hand keying this into the software. So then they take chances, and that's where data capture errors exist. And these are the kinds of things that we like to avoid as much as possible in the revenue cycle. Hang-ups in things like data capture. One of the most frequent reasons for claims not being paid is very simply due to data capture. So that might be patient date of birth, or address, or proper spelling of the name, or legal spelling of the name, the patient's ID, all of which, if you're having the patient's hand enter, if you are having the patient's hand write and your staff hand enter this information, then you are taking a chance that your staff or your patient might have a hiccup in what they're doing. So they might accidentally invert some numbers or forget to put the apartment number. And so when you start sending them bills or statements, it doesn't arrive to the proper address. So it really does start to increase the cost quite a bit. So 100% number one suggestion is, if you can at all costs, even just purchasing the software, PDF software that will do a form creation where you can have those patients hand typing. Even if you had them hand typing that information, filling it out electronically, and then bringing it into your office, that in itself will save a tremendous amount of effort and work on both your staff's time and the patient's time. In addition, it can also prevent you from having to worry about the patients, again, not properly filling out the form, or perhaps not filling out required pieces, because you can make some of those elements required. So I would seriously consider, at the very least, getting a PDF creator and having your patients complete your forms by typing them And obviously, there's in most cases, you're going to have some forms that can be generated securely by PDF. So if you have a software that allows you to communicate with your patients securely, then you can certainly have those patients transmit those intake forms prior to their appointment. So again, another time saver for your staff. So take all of those things into consideration with your patient registration. Patient appointments, the element of patient appointments is pretty essential to this process, right, for retention. So making sure that when your patients, even at the moment that the revenue cycle is initiated, you already have an opportunity for revenue being generated once the patient's referred to your office. So it's your staff's opportunity to ensure that that revenue cycle continues by ensuring that those patients arrive for their appointments. So what does that mean? That's things like reminders and proper reminders. Not saying that you should have your staff invest time in doing phone calls any longer, but I would suggest that you, at the very least, invest in a software that can do reminders via text or email, or perhaps even a robocall reminder to a patient's cell phone, if that's something that's possible. I also would suggest that you allow those patients to properly confirm their arrival. A lot of offices, we see patients being left voicemails or sent text messages, but they are not sent another reminder message or a phone call that just gives them an opportunity to say yes or no. A lot of our offices are able to book that appointment if that patient does not show up, especially a new patient appointment, right? We all know how much time that can take. So if you have devoted an hour or 30 to 45 minutes of your time to this new patient, and now that patient has not responded with a confirmed appointment, you definitely could have filled that appointment, and you would have then lost an opportunity for revenue. So I would say, at the very least, sending some sort of reminder electronically to those patients if you are not going to have those new patients, or have your staff call those patients to confirm their appointments. The other thing that you would like, that I think that you would consider a great investment of time, is allowing your staff to obtain all of the insurance or necessary insurance information prior to the patient's appointment. Nothing worse than having a patient make it all the way to the office to then find out that they have an insurance that is not covered by your office, or perhaps you are not in network with that particular insurance. In a lot of instances, this can determine whether a patient, or would determine whether a patient would seek care at your office. So at the very least, you should be having your staff do kind of a preliminary registration over the phone, even if they are not able to complete an entire patient file during their intake call or during their new patient appointment call. So really be mindful of your new patient script when you're creating it. Your new patient script should absolutely include questions like what's your insurance? Do you have an awareness of what your deductible is? Do you know whether your insurance company, whether we are underneath your insurance company? And these are just basic questions that if the patient was scheduling for the next morning for an emergency appointment, you perhaps could save yourself the effort of reaching out to an insurance company and running the risk of getting a denial. So I would go through the process, at the very least, of having those patients provide to you the detailed insurance information so that you can enter in their information to hopefully your eligibility system, so that you can do a quick check on that patient's benefits to ensure that they in fact are covered by that plan.